prone T-spine PA modes. I'm gonna lower, actually I'm gonna raise the table, because some I'm gonna do from the head downward in a, you know, cephalocaudal direction. And it's just kind of a hand position here, and I'm coming in, and I'm gonna always try to keep a chin tuck myself as best I can. I'm just to the sides of the spinous processes. Again, I'm not using my arms, I'm using my body weight. My arms are kind of locked. I don't have them hyperextended, but they're just kind of locked in. And so as I go down, I'm just leaning, and I'm feeling, well, how much pressure is his body giving me? And he starts giving me more pressure here. So there's some stiffness in the T-spine down through here. Sometimes I'll just do this, just kind of stroking, just kind of loosen them up. Do a little side to side. Yeah, really stiff right there. Now I've had patients tell me they've seen a chiropractor, and a chiropractor will put them in a position like this, and they just really crank on them and like really do a hard thrust. We're not doing that. We're mobilized. You okay?
Yeah, good.
So in that position, that helps me identify where he's most stiff, and I'll lower the table down. I'm gonna do some rotational PA T-spine mode. I kind of start in here, and I'm kind of doing this, kind of squeezing with my hands a little bit, and that helps. When I squeeze like that, though, I'm doing myself a right rotation of my hands, or a clockwise rotation of my hands, which makes the right T-spine or the right facet joints close and the left ones open. So it creates right side bending in that area, or right rotation, right? And then I'll make sure that my pressure here is a little higher up on his body than here. So facet joint here is going up and to the right. The lower facet joint is going to go down and to the left, right? So there's that way, and then I'm going to come and do the opposite rotation. Any osteoporosis, Johnny?
No.
Good. Sometimes I'll do some manips here. I don't do a lot this way. But I really just do some general rotational there, right? But really, when I felt most restriction was when I came here. You might hang out here for a couple minutes. Again, watch your neck posture. You might be tempted to keep your neck out, but always do a chin tuck when you can. Since we're in this position, let's go ahead and move into cleaning out the gutters. So the gutter being the muscle valley, or the valley here beside beside the spinous process, where the erector spinae lives, right? And then deep to that is the multifidus. Sometimes you can just get right in next to the spinous process and just kind of, like if there were leaves in there, just scooping out the leaves. Yeah, my hands are on him, and I'm moving his skin and fascia over those muscles. All right? So I'm not like moving over the skin. I'm on it, and I'm moving the skin over the muscle. And Johnny feels that.
Yeah, like you said, I don't feel the hand just moving over the tissues.
Yeah.
I feel the skin going just over over the muscles and over the bones.
And we'll go ahead and check the other side, do the other side. Hey Johnny, some of the soft tissue stuff I'm doing on you just because we're doing it right now for learning purposes. I don't do a lot of this on patients. I have realized the more soft tissue work you do on patients, the more soft tissue work you have to do on patients. And it may not be, sometimes it is, but sometimes it's not the most profitable use of your time. You may, for a visit or two or three, do some soft tissue work, try to loosen them up, and let them know up front. We're going to start kind of make sure your soft tissues are loose and working for you. Then we're going to basically rely on your program, your stretching, your exercises to handle the soft tissues with blood flow and mobility. And you're going to work on joint motion. Okay, so there's that. Okay.